In this video, we're going to review the anatomy of the respiratory system. More specifically, we're going to look at the anatomy of the upper respiratory tract. So in this picture, you can see the entire respiratory system, starting with the nose and ending with the lungs and every organ in between. But the respiratory system as a whole is going to be divided into two regions. You have the upper respiratory tract, which is made up of structures that are found in the head and neck area. So starting with the nose and ending with the larynx. And then below that, you have the lower respiratory tract, which is found mainly in the neck and thorax. And so it's going to start with the trachea, which is right below the larynx, and end in the lungs. So in this video, we're going to talk about the anatomy of the upper respiratory tract, and then in a further video, we will get into the lower respiratory tract. So let's start with the nose. This is the structure that's going to allow air to come into our upper respiratory tract using these openings called nares, also known as our nostrils. You'll notice that the nares or nostrils have hairs on the surface of them called guard hairs, and those hairs are there to filter out particulate matter that may be trying to come into the respiratory tract. So it's going to trap particulate matter and prevent it from being able to come in. Now, as that air comes into the nasal cavity, you will see that there are projections of tissue that fold inwards within that nasal cavity called nasal concave. So we have a superior, middle, and inferior nasal concave, which are divided by the nasal meatuses. Those are these tunnel-like passageways in between. But those conchae are inner foldings that help create turbulence of air as it comes into the nasal cavity. So as that air comes in through the nostrils, it hits those conchae, those foldings of tissue, and causes that air to be mixed around or churned around inside of that cavity. And the reason we want to create that turbulence is because the inside of this nasal cavity is also going to be lined with mucous membranes. And the mucus within those mucous membranes is there to serve as like a sticky trap to help trap more particulate matter that might be trying to come into the respiratory tract whenever we are breathing in. And so that particulate matter can be trapped in those mucous membranes and filtered out as that air is traveling deeper into the respiratory tract. That mucus also helps to moisten the air and to warm the air as it's traveling in through the respiratory tract. Now, the nasal cavity has a superior surface that's created by bones of the skull, but the inferior surface of the nasal cavity, you will see, is created by the palate. So we have a hard palate on the anterior side, which is made of bone, and then as you travel towards the posterior side, the hard palate gets converted into the soft palate, which is made of a softer form of connective tissue. And you will also see that that soft palate continues down to form the uvula. So the soft palate and the uvula are actually fairly flexible, and they're that way so that when you swallow food or drink and allow that to travel down the esophagus, that soft palate can fold up and prevent any food or drink from being able to come up into the upper part of the respiratory tract and cause any choking. There's also a nasal septum inside of this nasal cavity, which is going to divide the right and left halves of the nasal cavity. And it's going to be made up of some bone as well as some hyaline cartilage. Now, most of the upper respiratory tract is going to be lined with pseudostratified columnar epithelium, including this nasal cavity that we've been talking about. And that type of epithelium has cilia on the surface of its cells, and there are also goblet cells mixed within those epithelial cells that are there for mucus production. So they're the ones producing the mucus that I'm talking about here that's used to trap particulate matter. Now, once that mucus gets produced, the cilia on those pseudostratified cells can sweep that mucus into the pharynx. We will also have this type of epithelium down here in the trachea as well, and those cilia will sweep that mucus again up and out into the pharynx, into the throat here. And then once the mucus is in the pharynx, it can be swallowed down the esophagus and sent to the stomach where it can be digested. So this is a way for us to help purify the air and filter out any particulate matter and then kill any potential pathogens or microorganisms that might be present in that particulate matter that's being filtered out by sending it to the stomach to be digested. We also have olfactory epithelium in the roof of the nasal cavity up here, which is made up of nervous cells that are used for odor detection. So these are going to allow us to sense smells. So now let's move down into the pharynx, which is also known as the throat. And there are three different regions to the pharynx, as you can see here. The upper part of the pharynx is called the nasopharynx because it connects to the back of the nasal cavity. Below that we have the oropharynx, which connects to the oral cavity. And then below that we have the laryngopharynx, which you can see is kind of where we have our dividing point between our respiratory tract and our digestive tract. If you travel anteriorly, you will travel into the larynx, which is the next part of the respiratory tract. And if you were to travel down the laryngopharynx posteriorly, you would be traveling down the esophagus, which is part of the digestive tract. So these are the three regions of the pharynx. And we know that the pharynx is a very muscular structure. It has a lot of muscle present to help facilitate swallowing, allowing us to be able to swallow food, and to allow us to be able to speak. We need to use that muscle to be able to speak as well. Now, unlike the nasal cavity, which we said was lined with pseudostratified columnar epithelium, the nasopharynx and the oropharynx are primarily lined with stratified squamous epithelium because they are, going to be potentially exposed to friction or abrasion, so they need some extra layers of protection. The laryngopharynx, as we travel down into the larynx, you will start to begin to see that pseudostratified columnar epithelium lining the inside of those organs as well. And so this laryngopharynx is the main one that's going to help with swallowing and speech because it's going to be down here, again, where we see that division between the respiratory tract and the digestive tract. So now let's move down past the pharynx into the larynx, which is also known as the voice box. And here's a nice picture of the larynx from an anterior view. So on the anterior surface of the larynx, we see what's called the cricoid cartilage. You can see that on the posterior surface as well. You also have the thyroid cartilage, which is much larger. This is what forms the Adam's apple in males. So this is that piece that you can really see protruding out. It gets stimulated to get larger through testosterone production when males reach puberty, which is why tends to be a little bit larger than females. And on the posterior side, you can see the structure called the epiglottis. This is made of elastic cartilage, and that elastic cartilage, allows this structure to be very flexible because it's going to need to be able to fold over your larynx whenever you are swallowing to prevent any food or drink from getting down into your airways. We also have the hyoid bone, which is a very skinny, slender bone that is used as a movable base for your tongue. So the base of your tongue will attach to this bone, and it can pull against it for movement and to allow for speech as well. Down below the larynx, we also see the trachea, which is lined with rings of hyaline cartilage, kind of similar to that cricoid cartilage that we saw in the larynx. Now we know the larynx is going to provide sound, and it's going to also prevent food and drink from being able to enter into our respiratory passages. So this is another lateral view of the larynx, and you can kind of see some of those internal structures. So as I mentioned before, this epiglottis here, which is made of elastic cartilage, whenever we are swallowing, this will fold down and cover up the larynx and prevent any food or drink from entering in and causing any choking. So here's the opening of the larynx here, and then posteriorly you would have the esophagus found behind. This epiglottis can also kind of trigger a cough reflex. So if any food or drink does happen to get past the epiglottis into the larynx, this is when you will start that coughing process to try to remove that food or drink and get it out of the respiratory tract. If you ever have to be intubated, through endotracheal intubation, that's where they will place a breathing tube into the trachea to allow you to be able to get air down into your respiratory tract. And then we also know that there are vocal cords or vocal folds inside of the larynx, as you can see here on this lateral view. And if we look at a superior view, you can see them even better. So here are the vocal cords here and here on either side of the larynx. And then that vocal cords and the opening in between is known as the glottis. So this entire structure here is the glottis, which allows air to be able to come into the trachea and get down to our lungs. Here you can see the epiglottis that folds over the top and covers those organs whenever we are swallowing. So these vocal cords, as air passes through them, as air is leaving the respiratory tract and passes past those vocal cords, it will cause them to vibrate, and that's what gives off a sound to allow us to be able to speak or produce any kind of sound for that matter. Now, men tend to have a much larger larynx, and typically the larger the larynx is, the longer and the thicker these vocal folds or vocal cords will be, and that will typically cause the pitch of the sound that you make through your voice to be lower or deeper. So that's why men tend to have a little bit deeper voice than women, is again because their larynx tends to be much larger, causing these vocal cords to be longer and thicker, which again gives a deeper pitch to their voice. So you can change the size or the tension on these vocal cords through, adjustment of the cartilage. The cartilage can, adjust or pivot to alter tension on those vocal cords, and that can alter the pitch of your voice to allow you to have a deeper sound versus a higher pitch sound. So that's going to be the end of the upper respiratory tract. We will get into the lower respiratory tract in a further video.